Hello guys, welcome back to my YouTube channel. Today I am going to discuss about the anatomy of urinary bladder. From this video you will learn about the location of urinary bladder and the relations of the urinary bladder, anatomical relations, and also the blood supply, nerve supply and lymphatic drainage. When we talk about the location of the urinary bladder is situated immediately behind the pubic bones. You can see here, this is the pubic symphysis and this is the urinary bladder. Here, this is a section of, sagittal section of female body. You can see here the uterus and the vaginal canal, and here there is the bladder, and here is the urethra. So, you can see the urinary bladder is situated behind the pubic bones. Within the pelvis, you can see up to here the abdominal cavity. You can see the peritoneal covering here very clearly. So, this area is the pelvic cavity. So, the bladder is a pelvic organ. This urinary bladder stores urine, and in adults, it has a maximum capacity about 500 milliliters. Bladder is made up of muscular tissue. You can see it is strongly made up of muscular structure, muscular wall, and its shape and relations are vary according to the amount of urine that this bladder contains. If there is no urine or very low amount of urine in the bladder, it is like a pelvic organ like this. But if this is fills with urine, this bladder comes into suprapubic area as well. Here up to this, beyond this we call it as suprapubic area. So after this fills completely, so bladder comes up to suprapubic area. So the anatomical relations can be vary according to the amount of urine that this bladder contains. When urine fills in this bladder, the superior wall of the bladder can rises up to even hypogastric region. So you have to remember that this superior wall of the bladder can be enlarged up to hypogastric region. In young children, the empty bladder projects above the pelvic inlet. Later, it becomes a pelvic organ. When we talk about the shape of the bladder, this empty bladder is like a pyramidal in shape. You can see this like a pyramidal in shape. It has an apex here, this area. It has an apex which is pointed anteriorly, and it has a base here, and also a superior surface, as well as there are two inferolateral surfaces. This area is the bladder neck. So the apex of the bladder points anteriorly and lies behind the upper margin of the pubic bone or pubic symphysis. And this apex is connected with the umbilicus by median umbilical ligament, which is a remnant of Urachus. In this picture, you can see the umbilical ligaments and umbilical folds. Umbilical ligaments are the remnant structures, and umbilical fold is the name given after this after covering with the peritoneal layer. You can see this is a here as an example. This is a medial umbilical ligament. So this after covering by the peritoneal layer, this medial umbilical ligament becomes medial umbilical fold. I hope you can understand very clearly. This is the medial umbilical ligament without the peritoneum. After covering it with the peritoneum, umbilical ligaments we call as umbilical fold. So you can see here, this is the median umbilical fold, and this is the median umbilical ligament. Median umbilical ligament is the remnant of Urachus. So after it covers by the peritoneum, we called it as median umbilical fold. You can see this is the bladder. This is the umbilicus. This median umbilical ligament connects the apex of the bladder with the umbilicus. So these are medial umbilical ligament, and this is the, after it is covered by the peritoneum, we call this as medial umbilical ligament. So then this is the you can see this is the inferior hypogastric artery and inferior hypogastric vein. So they are, after they are covered by the peritoneal layer, we call them as lateral umbilical fold. Lateral umbilical fold. This median umbilical ligament is the obliterated umbilical artery. You have to remember those things. Those are MCQ points in anatomy. So remember that this medial umbilical ligament is the obliterated umbilical artery, and lateral umbilical fold is the um, inferior epigastric vessels after covered by the peritoneal layer. Hope you clear that. When we talk about the base or the posterior surface of the bladder, it is like this. It is like this, triangular in shape. This is triangular in shape, posterior surface of the base of the bladder, and it faces posteriorly. The superolateral angles are joined by the ureters. Here, these are the superolateral angles, and ureters come and join here, like this. These two are the ureteric orifices. These are the ureter. In males, two vas differences, or ductus difference, we call them this as ductus difference. Here, this is the ductus difference, and here is the seminal vesicles, and this is the prostate gland. You can see this is the ejaculatory duct, and then this is the bladder. In males, this ductus difference or vas difference lies side by side on posterior surface of the bladder, and they separate the seminal vesicles from each other. As you can see here, the upper part of the bladder is upper surface of the bladder is covered by the peritoneum. In males, this peritoneal layer here, this is the peritoneal layer which covers the superior surface of the bladder, and further posteriorly this peritoneal layer forms rectovesical pouch. Rectovesical pouch. Lower part of the posterior surface is separated from this rectum. This is the rectum now. So lower part of the bladder is separated by rectovesical fascia. You can see very clearly this is the rectovesical fascia. This is the rectovesical fascia. So this rectovesical fascia in males, it separates urinary bladder from the lower part of the urinary bladder from the rectum. Superior surface of the bladder is covered with peritoneum, and it is related with the coils of the ileum or sigmoid colon. Along the lateral margins of this surface, the peritoneum passes to the lateral pelvic walls also. Inferolateral surfaces of the bladder are related in front to the retropubic fatty pad. Here you can see this retropubic space, and you can see very clearly the yellowish color area. This is the retropubic fat pad of fat. Neck of the bladder, I showed you previously also. This is the neck of the bladder. It lies inferiorly and rests on the upper surface of the prostate gland, and here the smooth muscle fibers of the bladder wall are continuous with the prostate gland. So the neck of the bladder is held in position by puboprostatic ligaments. These are the puboprostatic ligaments. Puboprostatic means those ligament connect pubic symphysis and the prostate gland. And in females, we call this ligament as pubovesical ligament. This is the pubovesical ligament. In males, this ligament is connects the pubic symphysis and the prostate gland. But in females, remember very carefully, this ligament connects the pubic symphysis with the bladder neck. So we call it as pubovesical ligament. From this picture, you can see the interior aspect of the bladder. So this area is the mucous membrane of the bladder. So it has a greater role in emptying the bladder. So the area of mucous membrane covering the internal surface of the bladder is called as trigone of the bladder. So this, you can see this area, center of the trigone. These are the ureteral openings, and this is the prostate gland, and this is the bladder neck. You can see very clearly this is a highly muscular organ. And you can see the starting point of middle umbilical ligament, median umbilical ligament. Here the mucous membranes are always smooth even when the bladder is empty, because the mucous membrane is firmly adherent to the underlying muscular cord. So always this mucous membrane is smooth. You can see the superior angles of the trigone is corresponded with the openings of the ureters, and inferior angle to internal urethral orifice. Here this is the internal inferior angle of the trigone, and you can see it is open into internal urethral orifice. Then the ureters pierce the bladder wall obliquely, and this provides a valve-like action. You can see they are coming in an oblique manner here. Due to this oblique manner, and it acts as a valve-like structure, so it prevents the regurgitation or reverse flow of the urine via this ureters. Muscular cord. When we talk about the muscular cord of the bladder wall, we call this as detrusor muscle. You can see here very clearly detrusor muscle. And at the neck of the bladder, the circular component of muscle cord is thickened to form sphincter vesicae. Sphincters. Here, sphincters are formed. When we talk about the blood supply to the bladder, blood supply is coming from the inferior vesical artery, which is a branch of internal iliac artery, as well as the superior vesical arteries, which also a branch of internal iliac artery. When we talk about the venous drainage is from vesical venous plexus, and then vesical venous plexus drain into here. This is the vesical venous plexus around the bladder. This vesical venous plexus drains into vesical veins and thereby to the internal iliac vein. Remember, the lymphatic drainage is to internal and external, both internal and external iliac lymph nodes. When we talk about the nerve supply to the bladder, the sympathetic nerve fibers or the sympathetic nerve fibers coming from the L1 and L2 nerves to the inferior hypogastric plexus and thereby to the bladder. Then the parasympathetic preganglionic fibers coming from S1, S2 and S3 nerves, spinal nerves and they arise as pelvic splanchnic nerves. Those pelvic splanchnic nerves also comes towards the inferior hypogastric plexus and then it supplies to the bladder wall. So remember that sympathetic fibers coming from L1 and L2 and parasympathetic fibers coming from pelvic splanchnic nerves from S1, S2 and S3. Sympathetic afferents are also trouble with these sympathetic nerves, or it travels via hypogastric plexus and enters into L1 and L2 spinal segments. Then the parasympathetic nerves travels via pelvic splanchnic nerves. What happens when sympathetic nervous system stimulated? When sympathetic nervous system stimulated, those nerves inhibit the contraction of detrusor muscle of the bladder wall, as well as they stimulate the closure of the sphincter vesicae. When parasympathetic nerves are stimulated, they stimulate the contraction of the detrusor muscle of the bladder wall and inhibit the action of sphincter vesicae. So that's all about the anatomy of urinary bladder. Thank you for watching.